Well, good morning and welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, March 10th, 2020. And here are our top stories: the coronavirus's impact on technology and how tech can help. Well, joining me now is Daniel Klein. He's a senior technology and consumer products reporter with The Motley Fool. Dan, welcome back to the program.
Thanks for having me.
Well, it's great to talk to you. And, I think this coronavirus obviously is very scary for a lot of reasons, but it's also scary because of the volatility in the financial markets. But what I want to talk to you about this morning is the impact of corona to tech. Let's start there. Let's start with the supply chain.
Yeah, so it's going to be disruptive. It already has been disruptive. So one of the companies, and we talked about this on the podcast, one of the companies that's impacted is Apple. Apple is telling some of its vendors that there may be short-term disruption in the iPhone supply chain. So that might mean, just like when something sells out, you might go to T-Mobile or Sprint or Verizon or Best Buy or wherever it is you're going to get a phone and say, I'd like the new iPhone blah, blah, blah. And they will say, well, we don't have it. It's not going to be here for 4 or 5 days. Or you might have to take one that has maybe a feature you don't want or more memory, or maybe you even have to substitute out another phone. Now, Apple has been very forthcoming in saying that this is going to happen. The reality is it's probably going to happen with any major tech company. They all have exposure in China. So these could be short-term disruptions. These might be disruptions you don't see. There might be something like, let's say, the Nintendo Switch. Maybe there's plenty of inventory and stores will sell out, but they'll get to the point where they're selling their last couple as the new ones come in. So this may not impact you as a consumer, but the reality is there's going to be weird disruptions. You might see like an Amazon order that normally took a day. Maybe it takes 3 days because they didn't have it or they had to ship it from a different warehouse. Or maybe the warehouse it got shipped to had to send its workers home for the day because there was an outbreak. You're going to see a lot of sort of unpredictability. And I don't recommend, don't go to Costco and fill your house with water and beef jerky and toilet paper. On the other hand, if you normally buy 12 rolls of toilet paper, maybe buy 16. If you're buying cereal, maybe buy an extra box. Because there might be days where the kids are sent home from school or you're asked to not go into work. I know that, I drink a lot of canned coffee. And when I was at Publix the other day, I grabbed a couple more. I don't expect any massive disruption, but I expect it's possible that maybe Instacart will have days where they don't go to Publix or deliver, or that Publix won't get its delivery from the coffee vendors I like, and they're not going to have it. So this isn't a hurricane where people hoard all the bread and take all the milk. But this is something you should be aware of in the back of your head, that it could impact you. We're seeing major companies, Amazon and Google and people like that, Microsoft, and it's Amazon and Microsoft, not Google, telling people to stay home from work, to work from home. Well, most work can be done from home. I work from home, as you can all tell based on the shot here. But not everything my company does can be done from home. So that could cause disruptions.
Yeah, I think you're right. And you break it down. I mean, it's disruption that we're focusing on tech. But in terms of the supply chain, but we're also looking at airlines, fashion, because a lot of materials are come out of China and some of these other countries that have impacted. So clearly there's an expectation that things could be disrupted. Business as usual may not be business as usual for quite some time. And then from a stock valuation point of view, so let's go back to finance, because I want to cover a lot of different angles, but let's go back to finance. That looking at a company, you could see a company like Apple potentially, and I'm not saying this is the case, but have some earnings be perturbed as a result of this.
The next quarter is going to be bad for a lot of companies. So I'll cite you an example. Starbucks. Starbucks has taken a very responsible attitude in closing stores in China and coming out and saying we're going to put our customers and our workers first, and realize one of the major ways this virus spreads is the poorest people with the least access to healthcare are often the ones preparing our food. So if you are working at Starbucks, which pays a reasonable wage, but you're certainly not getting rich being a barista at Starbucks generally, you might wake up with a cold and decide to go to work anyway because you don't have paid sick time. You don't have, I don't know their exact policy. You may not have paid sick time left, or you may be afraid that it will cost you shifts if you don't go in. And I'm not picking on Starbucks. I'm just using them as an example of a food service company. So Starbucks has taken a very forward stance on this and said, we're going to close stores. We're going to be sort of better safe than sorry. And they closed a lot of stores in China. They've since reopened most of them. And that's going to have a short-term impact on sales. And as we talked about on the podcast, if you don't go to Starbucks Monday, Tuesday, and Wednesday, on Thursday when they reopen, you don't go and have 4 coffees. This isn't an iPhone where you'll just buy it later down the line. So there will be sales lost. But what I'll tell you as an investor is Starbucks closing for a week or a month going to fundamentally change their business? It's going to cost them money, but they'll eventually get back to where they were because nothing will change about your faith in the brand. This isn't, the Chipotle food health standard that sort of undercut people's belief in the brand. This is something beyond their control that they're going to take smart steps to deal with, or even if Starbucks doesn't have to close, traffic is going to be down in malls, in public places, because people are going to sort of be careful about when they go out. But nothing about this changes where Starbucks will be in 6 months, or the demand for a latte, or for the next unicorn frappuccino. So, and that's true of a lot of companies that will be impacted. So unless you've currently retired and have to make decisions about what to sell in your portfolio, don't look at your portfolio. Take a 6-month break. If you believe in these companies that you own, you might want to buy more if they take a downturn. Now, that doesn't mean if there was a company you were wavering on that you might not want to make changes in your portfolio. But if you fundamentally believe in companies like Apple, Starbucks, whatever brands are going to be impacted like this is a buying opportunity, not a sell-off.
Yeah, well, good advice. Dan, I want to hold you over. When we come back, we'll talk more about technology and the coronavirus. So stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
The windows on our homes, they protect us and the ones we love, but they do much more. At Renewal by Andersen, making your home more comfortable is at the center of every window we make. It's why we custom build our windows in America and install them in as little as 1 day. It's why we build our frames with exclusive Fibrex composite material that's 2 times stronger than vinyl. It's why our glass helps keep your home warmer in winter, cooler in summer, and quieter all year long. It's why we stand behind every window with a 20-year limited warranty. Why not help lower your energy costs while giving your home and family the best? Call 1-800-835-6525 to schedule a free in-home consultation. Buy one, get one at 40% off with this special offer. Plus, get special financing with no money down, no monthly payments, and no interest for 1 full year. Renewal by Andersen, the better way to a better window. Call 1-800-835-6525 now.
Welcome back. We're joined this morning by Daniel Klein, Senior Technology and Consumer Products Reporter. Dan, thanks so much for sticking around with us this morning.
Thanks for keeping me.
Well, very funny. So Dan, really interesting segment one about the impact of the supply chain. And, we often talk about, in the media often talks about how, social media and technology can be a bad thing. But I'm thinking in terms of separating people and, people have their heads down on their phones, et cetera, like that. But in this case, technology can actually be a good thing because you need to be isolated away from people in a lot of cases to prevent yourself from getting sick. So let's talk about that aspect, and specifically maybe start with telemedicine.
Yeah, absolutely. This is technology to the rescue. And before we get to telemedicine, I'll give an example. I work remotely. I work for the Motley Fool as a contracted writer, and my entire office was told to stay home one day this week to test our capacity to work remotely. I did not know that was happening until about 4 o'clock when one of my colleagues posted something about it on Facebook. So technology, our use of Slack and Zoom specifically, made it irrelevant that people weren't in the office. Now, obviously, if I'd had a Zoom meeting on video and I saw where my colleagues were sitting, I probably would have known that they weren't in a conference room in the office. But most of my contact that day was via Slack, and it didn't matter where anyone was. And that's a huge benefit. And I think you're going to see use of some of these products increase after this crisis has abated, because maybe we're going to realize, I used to fly to the office to go to this meeting, and boy, that's a big expense. Why wouldn't I just Zoom in for the meeting? Because the technology is so great. But with medicine, Teladoc, I'm a big fan. I use a variant of it through my wife's health insurance, where if I'm sick, I had a small infection on my finger a few months back, which I think we've actually talked about.
I remember that. Hopefully it's feeling better. You still have your digit, right?
Yeah, I sent a picture of it to a doctor through the health insurance homepage, and the doctor had a brief phone call consultation with me and called in a prescription to my local CVS. I went and picked it up. It saved me probably hundreds of dollars. I mean, insurance would have paid for it, but it was a $50 fee or a $25 fee. I'm not even sure which. And it was very easy. It saved me hours of time of sitting in a walk-in clinic. Well, Teladoc is going to allow people to go online and other services like Teladoc and say, hey, here are my symptoms. And your doctor will be able to say, hey, look, those symptoms are the flu. They're not coronavirus. Those symptoms are strep throat. They're probably not the coronavirus. Or, hey, those symptoms are the coronavirus. You are in a susceptible population. You should probably go to the doctor or the emergency room. Or you are not in a susceptible population. So you should go to bed and have some chicken soup. And here's what to watch for. If this gets worse, then you should do this. A lot of people are going to not leave the house, not sit in waiting rooms, not infect other people, because they have the ability to get doctor-level advice for a very small fee with very little waiting time or inconvenience. It's amazing how this works, and I think tens of thousands of people, maybe hundreds of thousands of people, are going to become aware of this because of this coronavirus situation.
Let me ask you a question. You mentioned Amazon, Microsoft, I think Amazon or Google.
Microsoft and Amazon.
Okay, thank you for that clarification. Sending people home. If we have all these workers working from home, is there any impact to bandwidth? Thinking, if you have a service provider, I use Verizon Fios in the home. That's how you and I connect. You have a provider. I don't know. Is that a concern?
So it depends where you live. In my building, and this is anecdotal, I work from home. At 6 o'clock, when everyone gets home from work, I am more likely to need to plug in to my Wi-Fi rather than use the the router and have it just float over the air because my video picture won't be as good. Connection times won't be as good. There's definitely types of internet where that does not matter. So if you live someplace and you notice times of day where more people are home, that your internet is slower, you should think about having a wired tethered connection, which will generally be faster than a Wi-Fi based connection. You should consider sort of like my family home in New Hampshire, we have a satellite-based connection. It's slow.
That's very slow.
I'm not entirely sure if all my neighbors were home also using their satellite-based connection. I don't think that would actually matter because they're all pointing at the sky. Now, when we had a hurricane here and internet went down, this was about 3 years ago, my assumption was I could use the Wi-Fi hotspot on my phone as a way to connect to the internet. And the reality was the stress on the cellular networks, probably exacerbated by some towers being damaged, made it so I could barely send a text message, let alone use my phone for the internet. So yeah, you want to plan accordingly, and you need to think about how much of my job is internet dependent. If your job is very internet dependent, companies might say, well, hey, everybody stay home, but hey, you 5 people come to the office because you need high-end internet, and we're not going to have this big problem of masses of people if only a couple of exceptions are made and people come in. You might actually have more isolation in the office than you would in, say, in a building like I live in.
Dan, what does this do to productivity? In some ways, I think this would be more productive because I actually get more work now that I'm working from home. I get more work done, and I get it done in a shorter period of time. Just don't tell anybody. But there are some rules of thumb where people do not like telecommuting because there's a lack of the ability to monitor. So I guess, what's your thought on productivity being impacted as a result of more of this?
Yeah, I mean, some people are wired to work at home and some aren't. The reality is it depends what you do. If you have a week or 2 week long disruption and you normally work in an office and a lot of your work is collaborative, you can recreate that online to an extent, but you might just have to accept that these aren't going to be your most productive weeks. Mm-hmm. If you're someone like me who's a writer, and I had very few distractions yesterday because some regular meetings were canceled because people weren't all in the office. I think I wrote 9 stories yesterday because I had sort of very long, and I went grocery shopping and I took a swim. So it was a very, very productive day for me because some of the things that distract me, even when I work at home, weren't here. Now, I'll give you the basic tips. If you work from home, don't work next to, I'm sitting next to my Xbox, but don't turn your Xbox on. Don't have the television on if that's going to distract you. Put your phone someplace else if you're able to do that. Use your notifications on social media. I know that if I'm doing something like what we're doing now, I put myself as unavailable on Slack. Now, can someone still force a message through? Absolutely. So if the message is, Dan, your house is on fire, they could force that through and I'll know and I'll leave the show. But the reality is, control your time to be productive and do sprints. Take a period of time where you say, okay, this is what I'm going to focus on. This is the highest value to me, and just get it done. Mm-hmm. I front load my day. I get up early and I try to get all the work I have to do done in the first half of the day. So the second half of the day is more optional. Now, obviously, I don't work a timed job like most people. I work a productivity-based job. But when you're working from home, you have a lot more freedom to say, I'm going to take a gym break or a lunch break because you didn't have all this commuting time. So enjoy it and just hold yourself accountable for the work you need to get done.
Dan, last question. We've got about a minute left. Let's talk about the psychological effects of working from home and kind of being, if you're not used to it, and being, in a way, isolated. I mean, depression, and neither of us are clinicians, so we really can't diagnose this. But I can tell you that being not around colleagues all the time, that can be challenging for me in particular.
Yeah, it is. And some of the ways I deal with it are not relevant given the coronavirus. One of the things I do is I travel at every opportunity. So if I can go to a trade show with a colleague, I do. If I can go to the office, I do. Obviously, we mentioned earlier, a trade show I was going to has been canceled or postponed until September. I'm supposed to be in the office in a couple weeks. There might not be anyone in the office to visit. But one of the things you can do is just take the people you're close to, your friends, your people, whether they work with you or they're just personal friends, and schedule calls. I had a couple of calls this week just with work friends just to talk. And we talked about work, but it's very important that you do that. And I know we have similar situations. My wife leaves and goes to a regular job where she has meetings and talks to people all day. And many times when she gets home, the last thing she wants to do is talk. So I try not to be super needy. I have a personal trainer come to my condo 3 times a week. He gets his fill of me talking to him because I haven't spoken out loud all day. So find your ways to deal with it. That might be finding someone you work next to at Starbucks occasionally. Obviously, maybe not as relevant for the coronavirus. It might be making sure you have social plans on evenings or weekends or whatever it is. But yeah, it is isolating to work alone. And there are some people who love that. I do not. I miss having coffee breaks with workers. I miss lunch dates and all the other things you can do at work. So I try very aggressively to find other ways to get that human contact.
Yeah, very interesting. Well, Dan, thanks so much for joining us on the program today, and look forward to having you back on the podcast later in the week.
We'll see you soon.
And that wraps up this episode of BRN AM. Don't forget, for all the news in retirement, markets, technology, personal finance, and so much more, check out today's edition of The Morning Pulse. So until tomorrow, I'm Jeff Snyder. Keep on saving, and don't forget, roll with the changes.
Attention! The Centers for Medicare and Medicaid Services has officially authorized new benefits that Medicare Advantage plans may include. To get the benefits you deserve, you can call the Medicare Coverage Helpline.
Hi, I'm Joe Namath. If you're on Medicare, this is important information. I called the Medicare Coverage Helpline and they instantly looked up my coverage. In this one simple call, they offered to enroll me in a plan that includes rides to medical appointments, private home aides, doctors and nurses' visits by telephone, and even home-delivered meals. The plan also includes dental, vision, hearing, and prescription drug coverage, all at no additional cost.
Don't delay. Call to see if the new benefits are available in your area.
Call the number on your screen now. It's free.
Call 1-800-757-1451. That's 1-800-757-1451.